For infants that come into the world dependent on drugs, life has a rough start.
They sometimes have this loud, piercing cry in spite of everything that is being done for them. These babies are also very jittery, very irritable, difficult to console just by holding. Their respiratory system can be affected. They may breathe fast. Their gastrointestinal system may be affected. They don't do well with feedings. They may have vomiting and diarrhea related to their withdrawal.
Neonatal Abstinence Syndrome is where an infant is in utero, exposed to medications that could be prescribed or not prescribed. The infant, when delivered, has to withdraw from those, just like a mother has to withdraw. Depending on the medication, we have to provide medicines to help that patient or that infant withdraw slowly.
Unfortunately, weaning infants off those drugs has become a growing concern in Tennessee.
We are really in the epicenter of the problem within the United States. It's very centralized in Appalachia, though it is spreading across the United States.
In 2010, as the number of babies with NAS increased, the doctors and nurses at East Tennessee Children's Hospital discovered they were dealing with an epidemic that had no established medical protocols. So they created them, with an innovative care regimen that included a specialized NICU that minimized light and sound, a comprehensive system that scored symptoms, and one very hands-on calming technique.
It's the job of the cuddler to come in and hold them, rock them, and try to get them back to sleep. I like to talk to them and I tell stories. My singing is kind of bad and they fall asleep to that. And sometimes my yoga breathing puts them to sleep.
Blue Cross was a source of comfort as well, providing the support needed to properly care for these babies, while helping the hospital become a leading authority on NAS treatment. With help from Blue Cross, EDGE is making big strides in the fight against NAS. By continually fine-tuning their process, babies now spend up to 7 fewer days in the hospital. The program has become so successful that the NICU staff is often asked to speak to other hospitals facing the same issue and attend conferences that shape prescription drug laws. Proof that the right partnerships can make a tremendous impact.
It's a real privilege to have one of our providers come on board with us and work with us in understanding the problem and to be supportive of providing the best care, not just the quickest care, but the best care.
So anytime you have a situation where the healthcare providers and the insurance companies are on the same page trying to work together to make things better, I think that's a plus for everyone.
We're all in this together because we share a duty to keep our children happy and healthy.
There's a lot of emotions, but at the end, when you're connecting all the dots, you're seeing the larger picture. You're seeing a mother get better. A mother and a father get to take an infant home and know that their life's improving. It's a joy you can't really explain.
We're dedicated to nurturing more healthy babies and creating a better, healthier state. Blue Cross Blue Shield of Tennessee is for Tennessee.